This is Boomer Life on CL 650.
All right, Boomer Life is on CL 650. I'm Zach Spencer, and joining me today from Integrative Naturopathic Medical Center in Vancouver at Broadway and Granville is Dr. Hal Brown. And we kind of teased it before the break. We're talking about pain and pain management and what you can do with your colleagues to help people through with problems. Regenerative injection therapies. No one likes needles. So what is it that you do, and what can this help solve?
Yes, you're right. We all hate needles.
Yeah.
And I hate getting them myself.
Yeah, yeah.
However, I get them because I have seen the benefits of them. And we don't do it unless people want to get better.
Yeah.
Okay.
Well, this is interesting because, going to see somebody about pain and they say, oh, is this okay if I do this? And I just want the pain to go away. And so you must get that in your practice. People come in and they say, Doc, listen, I just want to feel better. So if this is going to make me feel better, I'm in.
I have lots of that. I have lots of everything.
Yeah.
But yes, that's definitely one attitude that some people have. They want to get better and they'll do whatever it takes. And they're a lot of fun.
And it depends how long they've been dealing with it, too.
Oh, this is it. I mean, when you're at the end of your road, you've tried what feels like everything, and then there's another option, then, there's some hope.
Yeah. Okay, so let's get back to the question at hand. So regenerative injection therapy, what is it and how does it work?
Okay, we were talking about inflammation earlier, and how inflammation is the body's natural response to injury and the body's method of healing itself when there has been damage to connective tissue, to ligaments and tendons and to joints. When we do sort of the most introductory level of injection therapy would be prolotherapy. And prolotherapy is a treatment where we take dextrose in a syringe with a few other things and we inject it on the painful injured sites. What that does
is it deep or shallow injections?
Well, if you're on a ligament or a tendon, you have to go to where it attaches on the bone.
Right. Yeah. Wow. That's what nobody likes to see, that needle.
Well, we put anesthetic in there. Nobody ever sees the needle. I keep them well hidden.
I'm just thinking, everybody's listening now and they're like, wow, that must be some needle.
No, you won't see the needle in my office. Yeah, and also, I have an ultrasound machine, so
you know exactly where you're going.
We can see where we're going. Yeah. So what we're doing with this syringe of sugar, I tell people not to eat dextrose, and then I inject it into them. So it's a bit of a contradiction. But what we're doing is we're using that dextrose to irritate the injury site. We're actually re-injuring it, and we're trying to reproduce a natural inflammation. We're trying to force the body into trying to heal itself again.
Okay.
So what happens is we irritate it, it swells up, there's usually some swelling after treatment, and we have blood supply and all the white blood cells and the red blood cells come in there. And one of the things that's most important for the healing response are the platelets, because in the platelets are the chemicals called the growth factors, and the growth factors are what stimulate the regeneration of ligaments and tendons.
Okay, a quick question for you. If you have an area of ligaments and tendons that are damaged, and why isn't the body already doing that? Like, why would it have gone from the initial swelling that you mentioned to not having that now? What happens?
Well, as we talked about earlier, when you have your original injury and you have the inflammation, the inflammatory phase goes on for about 3 days. Then the remodeling phase happens. So there's lots of reasons why somebody may not have successfully remodeled. Perhaps their general healing system is compromised. Perhaps they put ice on it or took anti-inflammatory medications. Perhaps that injury was greater than the body's ability to heal itself. And maybe what I call the X factor, the things we don't know.
Right. And so when you go through this process and you injure and aggravate the area, and you start to get that the swelling and the body building itself back, is it usually work with just one treatment, or is it multiple times you have to come back?
Well, we have to look at what we're trying to do. So we were talking about, for example, your back as being a case of unstable loose ligaments in the lower back. And I'm not diagnosing you. I'm saying, but let's just say
You'll check me out after the show, son.
let's just say that's what we have to deal with you. Okay, so every time we do one of those injections, we're stimulating a remodeling, and a new layer of ligament begins to grow. It takes about 6 weeks to grow one new layer of ligament.
Okay.
Now, once in a while, we get really lucky, and we do one treatment, and then that's enough, and people feel better. But that's not usually the case.
Sure.
Usually we have to grow another layer, and we have to grow another layer. So I don't know how many layers we actually need to do to succeed with a problem. So I can make my best guesstimate, and we might do it 3 times or 2 times, or we might do it 6 times.
Mm-hmm. And how long in between do you typically see a patient?
Oh, I might do it every week or every month. Every person's a little different.
Right.
Sometimes, and a lot of people come from far away, so
yeah,
we might not see them that often.
Sure. And so are there injections for other kinds of things, like nervous system targeting?
Well, that's an interesting question, because I think in some way a lot of these treatments are ultimately nervous system treatments. So you can't really separate them. There's an interesting phenomenon. We have nerves that are under the skin called subcutaneous nerves. They're very shallow. And those nerves can get inflamed or damaged. And when they produce pain, they produce pain that actually feels like joint pain. And a lot of those nerves go right over ligaments. And sometimes people have surgery and they have scars on those nerves, or sometimes it's just that nerve's just going through the joint. And there's been some interesting research that's demonstrated that inflammation and damage in those nerves actually can cause regeneration or degeneration of a joint. And when those nerves are treated with sugar, then that joint can regenerate.
So they're almost blocking the regenerative process, the nervous system.
Exactly, exactly. So when we look at a patient's health problems, we're going to look at not only ligaments and tendons, also have to look at the nervous system in the area. Sometimes nerves can get entrapped in fascia or other tissues, and deeper nerves can actually produce pain that may feel like joint pain. So, and then on top of that, we can get very complicated with this if you like. Let's talk about your whiplash cases you brought up earlier, for example. So one of the things that happens with more serious whiplash injuries is people have all these sort of vaguer symptoms, not just pain, but they're losing sleep, they're losing appetite, they've lost libido, they're depressed. There's all these kind of what I call softer symptoms, like not musculoskeletal pain symptoms, but really they're in a kind of a disturbed state. And the reason for that is that the autonomic nervous system, which is the unconscious control for everything that happens in your body, it's like a yin and a yang. You have a parasympathetic and a sympathetic. And if you think about when you go into fight or flight, when you have a shock, then you're in a hypersympathetic state. Now the interesting thing is the sympathetic nerves go right down the front of the spine. Okay, the chiropractors have understood this for years, that adjusting the spine will affect how the sympathetic nerves affect the organs of the body. We see this all the time in practice.
You see that on the chart on the wall.
That's exactly right. Yeah. However, what also happens is these, there's centers, like little control centers, like little brains all the way down the spine that control local areas. And there's a center right at the base of the neck, at the front of the neck, the stellate ganglion, which is the control for the neck and the upper body. And if that center gets traumatized in an injury, it'll go into localized fight or flight. And that's the reason a lot of these people have all these other types of symptoms in conjunction with a motor vehicle injury and a rear ender.
So as somebody who knows that, what do you do to treat somebody who's had a what they call a soft tissue injury from rear ender, and they have these just not feeling well symptoms? Yeah,
then we have another injection therapy.
Okay.
One of my favorites, called neural therapy, and that's using anesthetics with small amounts of sugar to treat nerves.
Okay.
So it's just a variation on what we're talking about. We can treat subcutaneous nerves, and we can treat autonomic nerves with sugar injections and with anesthetic injections.
Now you were mentioning before we came on the air, ozone. You utilize that for what purpose?
Oh, ozone's lots of fun. We all know about the ozone layer.
Yeah.
The ozone layer is oxygen in the atmosphere. When it's exposed to ultraviolet light from the sun, they break down into O1, and the O1s recombine into O3s. It's a very fragile molecule, which is why the ozone layer is so vulnerable pollution. Well, we can reproduce that. We have a little machine that has ultraviolet light, and it actually breaks up the oxygen and forms ozone. And we use ozone medically. It's been used in Europe for, I think, since the early 1900s. And it's a marvelous therapy. And we can use it for systemic health problems. It will cause the part of the cell that produces energy to function much more effectively. So every cell in the body can start to work in a much more effective way. But we can also use it in joints and ligaments. When you put ozone into an injured area, what you're doing is you're putting in oxygen and ozonides. So that oxygen is O2 and ozonides are O1. So the O3 breaks down into an O2 and an O1. And oxygen, as we know, is necessary for healing everything. Oxygen's also, when tissue is oxygen deprived, it's painful. And the ozonides, the O1, has a very strong regenerative effect. So in addition to some of our regenerative injection solutions, we put ozone in so we get more regeneration effect.
So it's an amplifier, basically.
That's right. And on top of that, we all know that ozone is used in swimming pools and hot tubs.
To clean.
To clean them, to sterilize it. Right? It's antibacterial.
If you get one of those bottles of water, they use reverse osmosis, I guess.
Well, that's a little bit of a different method.
Okay.
Okay, that's different than ozonating water.
Yes.
But you can ozonate water and drink it.
Yeah.
Tastes terrible, but you can do it. But when we put ozone into a joint, it's like an antiseptic. And what's really interesting, there's some really interesting research that's demonstrated that a certain percentage of herniated disc problems are actually coming from infections. And when little pieces of disc that have been taken out in surgery are cultured, they actually show that there's actually bacteria there. And there have been studies that have demonstrated that when these patients are given antibiotics, their back pain goes away. So I think there's an understanding that some joint problems, I'm not saying all, I'm not saying, I wouldn't know what percentage really, can have an infectious component to it. And that's why I like using the ozone. It just helps cover a lot more bases.
So you would do the injections with the sugars mix, and then you do the ozone at the same time? Do they always go together?
Often.
Yeah.
Most of the time.
So how many needles or injections, I should say, do you typically do for one joint? Is there one or two, or is it? If it depends if it's a larger area.
It depends what we're trying to do. Like for example, if we have a badly degenerated arthritic knee, we might just do one large injection inside the joint. Often people that have sports injuries might have injured perhaps the medial ligaments, so we might have to do a couple of injections there, or the patella tendon, we might do something there. So it's really a matter of, what are we trying to fix?
Right, and tailor the treatment for that.
We'll do the number that we need to.
Yeah, and the one thing I want to talk about after the break is the whole part of being regenerative, and you're saying that you can get back something that you've lost, and how long does that last? When we return next, talking about pain and how you can manage or maybe alleviate. Integrative Naturopathic Medical Center in Vancouver and Broadway. Our guest today is Dr. Hal Brown, and we'll continue the conversation on Boomer Life right here on CL 650.
Celebrating the baby boomer lifestyle. This is Boomer Life on CL 650.